Thank you so much for joining today's conversation, which is the first of two of our Take Action Mondays. My name is Elizabeth Gavin. I'm a registered nurse and a native New Yorker with a passion in health and wellness. And I'm here today to facilitate a conversation on protecting our frontline workers. A little bit about me. I've worked as a registered nurse inside of hospitals for over 11 years in a variety of settings: emergency room, postpartum, labor and delivery, and oncology. But I'm currently working remotely as a school nurse, and I began that about a year ago. This conversation was originally going to be between myself and Denise Octavia Smith, who is the executive director of the National Association of Community Health Workers. Unfortunately, she couldn't make it today due to an urgent strategy call that was happening. So we do want to thank Denise for all of her work and everything she's doing. Hi, everyone. I'm just checking out everybody following. Thank you so much for coming and participating in this conversation. I'm going to be, so although Denise was not able to make it, we're so honored to have Erin Miller, who is a nurse practitioner and a nurse who's currently working inside of a large hospital setting, community hospital setting in Manhattan. And so I'm going to bring her on so we can get her perspective and hear from someone who's currently working inside of a hospital in New York City. Give me 1 second. Okay, so she'll be with us shortly.
Hello.
Hi.
I'm Erin.
Thank you so much for joining us.
Yes, of course. Thank you for having me.
Thank you. I can see you. I don't see me. I guess that's fine. Can you see me?
I can't at the moment.
Huh. Okay. Let's see. There's something else. Oh, you know what?
Okay. Yes.
I think my camera may have switched. Oops. So sorry.
That's okay.
Okay, there we go.
Hi.
Hi. Sorry about that.
That's okay. So,
okay, here we go.
Yeah.
Now I see you. How are you today? Tell me, this is our first time meeting, so please introduce yourself.
Yes. Thank you for having me. My name is Erin. I do work at a large teaching hospital in the city, and I was redeployed on a COVID unit about 2 weeks ago. So it's been an interesting experience, to say the least. I was working in an outpatient department prior to that, and however, I do have experience inpatient. So when I was asked to volunteer by the hospital, I said yes. And and a lot of us felt the same way, that we're working in a department like mine. Since we had the time, the department was essentially closed except for telemedicine visits, that we had the time to help our colleagues. So it's overall been a more smooth experience actually than I expected it to be at the hospital that I'm working at.
Got it.
Yeah.
That's intense. I know that's a big transition, going from outpatient back to inpatient, especially under these circumstances.
I've been working with a different population in the past, actually in pediatrics, so being back in the adult world is quite different. I do have experience working with adults, so which is part of the reason why I volunteered. I felt capable, but it's definitely been a learning experience.
Right. And so are you experiencing any shortage of personal protective equipment at this point, or have you noticed, like, are you fearful around contracting the virus yourself, or tell me a little bit more about what you're hearing from your colleagues.
Right, right. So I would say, as far as myself, I am somewhat fearful of contracting the illness, but more so in regard to spreading it to loved ones or, my husband. So I
Right.
would say that, I could probably speak for most of my colleagues. I think they're on the same page that, they're feel fearful of, possibly bringing it home either on their, you know, personal um, equipment or their scrubs. One thing that the hospital has done is provided scrub access to everyone. So I think that's made a big difference as far as like keeping us reassured and safe and not bringing um, possibly like infected scrubs or dirty scrubs home. So
Right. Are you all having to reuse N95s at this point?
I haven't needed to do that. Each day that I've gone to the hospital, I've been given a new N95 in my size. So that's been reassuring, although I know that that's not the case like nationwide. So I think it
Right.
definitely depends on the type of facility you're working in.
Got it. Yeah, I do have a friend who currently works in an emergency room in Manhattan, and she reuses her N95 ongoing. The only time she's given a new one is when she's going into a code, and
Oh
so
wow.
it's really concerning, of course. Um,
Definitely. Yeah.
yeah. So, and I understand there's also, part of the deployment that's happening where like nurses are being moved to different units.
Hmm.
Has to do with people, having a shortage of nurses. And do you
Right.
find true, like people are calling out, or just
Yes.
concerned?
Yes, I've seen that in my own department where I usually work and on the units, on the inpatient medical units. So it's definitely an issue, which is why they've needed volunteers from inside the hospital and from outside the hospital. So,
Right.
I did receive a letter from the state as well requesting that I volunteer. So I think, you know, they were reaching out to anybody who would be willing. Uh,
Right.
yeah.
Interesting. I mean, I know that, like, according to a recent report from NPR, that there's already, it states nearly 9,300 healthcare workers have contracted COVID, and
Mm.
that there is a report of 27 deaths at this point, and that over 55%, I believe, of the people who have contracted it, the healthcare workers, they believe they got it at work. So
Right.
you're saying this is a really serious issue for all people working as essential workers or frontline workers, nurses, doctors,
Right.
the patient care assistants, janitorial staff, maintenance. It's intense.
Yeah, it
Yeah.
is. It's scary.
Um,
Um,
I actually just I read that the CDC dropped the precautionary level of PPE. Is that true? Have you heard that? That they moved from, I think it was like airborne to contact, not contact, but
Special droplet.
yeah, to droplet.
Hmm.
What
Yeah,
do you think of that?
yeah. I mean, I can speak for what I've seen is that they'll
Mm-hmm.
they'll require, essentially, that they're saying that it's contact plus special droplet, meaning, in contact precautions you don't have to wear a face shield, but in special droplet you do. So they're combining the two. They're not
Mm-hmm.
calling it airborne, but they're saying that it's both contact and special droplet. So we're
Okay.
wearing in airborne. I think it would be a next level like type of suit that you would be wearing, as we saw with like the Ebola virus, but with with this virus, we're only wearing the face mask and obviously the gloves and the N95. So
Right.
it's not considered airborne according to what they're saying.
Got it.
Yeah.
Um, one of the questions that's tied to this conversation is seeing higher rates of infection in communities of color, specifically Black and Latino communities, and saw that 34% of Latinx people are being affected, like being diagnosed with COVID in New York City. Have you what have you noticed, and what kind of conversations are you hearing regarding this inside in your hospital?
Right. I have definitely noticed this. I noticed this right when I started 2 weeks ago. Um, that the majority of the patients that I've taken care of are from communities of, you know, that have disparities. So I would say Black and Hispanic communities that have, you know, lack of access to healthcare, um, and who may have had comorbidities that were undiagnosed for a long time, or live in a setting where there's multiple people in the home.
Right. I mean,
So,
as exactly, and I mean, as we know, you know, oftentimes we see in the media people are, reporting that this is in certain communities, but not really be, directly speaking about the root cause. From my understanding, it really is racism and systemic oppression and environment and lack of access to food and different things that is really affecting groups in the city.
right.
Do you feel like amongst your colleagues that there's any conversation about these issues, or is it just so busy that you're just kind of consumed with the work that you have to do? Because I could imagine it's hard to have conversations about, like, reimagining how to help the root cause of these conditions. When you're so overwhelmed with the physical
Right.
provided. But I'm just curious, if you've had any dialogue with any coworkers, or like what are people saying?
Right. I actually just had a conversation with one of the physicians I work with this morning about this like very topic. But I think it's a combination of both. Like I think we are kind of consumed with what's going on. So like interventions need to happen, but I'm not sure if in this moment it's ideal. But I would say yes, overall there needs to be something done in terms of what can we do for these populations. I know that social work has been a huge help in our hospital, providing um, transportations for these patients home that wouldn't have any other way to get home, and trying to do the bet and paying for other things for them, and relieving their hospital bill. Like some of them are not insured, so um, making sure that they're not also like burdened with the cost of everything once they get home. So there definitely needs to be something done. But I think, as you're saying, it's in the moment. It is definitely trying to to have those conversations. And I mean,
Yeah,
we're having the conversations, but as far as like interventions,
right.
yeah, yeah,
I know there's a lot of efforts happening to address, implicit bias and racism within healthcare. So um, I'm happy that that's happening. Those conversations are happening amongst white providers like ourselves. People that are on the inside and
right,
are in a position to advocate and speak up and stand
right,
up for people that their care may be different than, say, a very wealthy white man, for
right,
example.
right.
These are all like really deep topics. I know that there's more conversation going to be happening about this with the Art and Social Activism panel on Wednesday. So for our viewers right now, be sure to tune into that. Um, yeah, thank you. It's helpful to hear from somebody on the inside for sure. Um, yeah, I spoke with Denise Octavia Smith from the National Association of Community Health Workers, and she shared, although she couldn't make it today, she shared some of her insights. She had a community health worker who was hospitalized for 30 days and, unconscious. And when she came out of it, she asked the providers, what did you do for me? And she was so emotionally moved by the fact that they said that really all they could do for her was turn her frequently, like turn her body every couple of hours, and that she was really moved by that. Because a lot of times we think we're going to get a specific drug or treatment, and
Right.
we don't have that right now. So I think we're
Right.
all, reconciling with the fact that we don't have any specific drug or treatment or quick fix to this, and that it's really the compassion and the love of the healthcare workers like yourself that are really, putting your lives at risk every day to go in and do this work. So
Right.
it's amazing. Thank you so much for what you do.
Yeah, of
Yeah,
course. Yeah, I know that.
yeah,
Um, I'm not even doing close to what like the bedside nurses are doing. I mean, they're the ones who are really like really at the front line, um, and the respiratory therapists. So, I mean,
right.
yeah, I thank them every day. It's very difficult what they're doing.
It
But
is.
yes, thank you for mentioning
Yeah,
that.
so you're in a nurse practitioner role. I think for our viewers, maybe not everybody knows the difference between the nurse practitioner role and an RN. Do you want to
Right.
explain that a little?
Sure. So
We have some people just coming on right now, so
sure. Yeah,
yeah,
so the bedside nurses are carrying out the medical plan and the care plan for the day, and they're really the ones who are at the forefront because they are in the
right,
room with the patients the entire day. Versus, so oftentimes they'll be in the um, all of the equipment, all of the PPE equipment for longer periods than we are, and they're at the forefront really. So, I mean, I was speaking to some of my colleagues on our medical teams saying that we compared to that we're really not on the front lines, just
got
because
it.
they're in the room for much longer periods of time and exposed to the virus for longer.
Yeah,
So I would say with what I'm doing is more so the nurse practitioner, and PAs, and residents, fellows, physicians. We're on medical teams, and we do round on the patients and we assess them twice a day and come up with a plan of care. But we're, as I said, just not carrying out those tasks the way that the
right.
nurses are doing. Yeah.
Do you think that the nurses are receiving new N95s every day as well? And are you aware if they are or they aren't?
The at where I'm working, they are receiving new N95s a day, each day. However, we are being really cautious about conserving them. So we'll wear obviously the same one for one full day, but put it in a plastic bag and save it in case we do run into a situation where we wouldn't have a new one every day. So after 3 use, then you can reuse the one that you were wearing earlier in the week, as long as it's been in a plastic bag, contained bag. So we've all been doing that just to be a little vigilant and cautious.
Got it.
Yeah. So yeah.
Helpful to hear your experience. I know that this is like that there are artists and people who are part of the festival who are, you know, creating masks that they can use for themselves and for their family, outside, which isn't the same as like wearing something in the hospital. But I did hear that nurses and doctors are wearing homemade masks like on top of their N95s to help them,
Yes.
you know, reduce the amount of viral exposure on their mask each day. Have you seen that at all?
Right. Yes, I have seen that, and I think actually a really good thing. People are wearing surgical masks on top of an N95 for more the purpose of keeping the N95 clean on the
Right.
outside, so that you
Mm-hmm.
can reuse it if you need to, or you know, not contaminate it. So the outside of it. So the homemade surgical masks are a really good idea, I think, and I have seen people wear them. I think it's great. Oh, I'm sorry, I lost you for a second.
Sorry, I'm back.
That's okay.
Oh,
So
good.
go
Now
ahead.
I see you completely. Um, did you see something at the bottom of my screen before? I hope not.
Um, no,
Okay.
no.
Okay, good. I can see you. I can see you better now. Great. Well, um, we've touched upon, you know, what you're currently doing. That right now, what I'm hearing is that PPE is somewhat limited, but you do have N95s that you wear. You get a new one each day. That isn't the case at all hospitals. I'm wondering, do you have any friends that are working in like public hospitals versus private? Have you heard of any disparities in terms of access? That are we seeing that?
Mm-hmm.
Have you heard of anything?
I have heard about hospitals in other states as well that are not getting the PPE that they need, and that it's much more of a struggle to get a new N95 each day. So I've definitely heard that. I don't have like a personal colleague that has experienced it, but I have seen it, especially in other states.
Got it.
Yeah, that
Yeah.
it's a definite. It's it's a significant problem. So I mean, I think if people can make homemade PPE
Right.
or even donate what they have is another great idea
Right.
to help the healthcare workers.
Totally. So one of the things that I've been thinking about is just how our mood and our mental health is so affected by these periods of isolation and, fear around exposure when essential workers are going out and, putting themselves at higher risk of contracting the virus.
Right.
Um, have you noticed the hospitals putting together any efforts to support the staff and families, like on a more holistic level, or providing any resources? Have you
Right.
noticed that?
Yeah. I mean, actually, there is an office called the Office of Wellbeing and Resilience at my hospital, and I'm sure it could be it's probably similar in other large teaching facilities in the city that they are providing like Zoom calls, video calls to do different things. So some of it is like a mindfulness conversation or
Mm-hmm.
even yoga, like chair yoga. They offer like twice a week, and Tai Chi. So all of those things I think are really great that they're doing specifically. They hold also like video calls with social workers that work within the hospital to
Okay.
speak about either experience that just to share experiences can really help, I think, um, and receive like mutual support. So those have been some good things within the hospital, and then I've seen outside that there are organizations like in the city too for people to reach out to for
Mm-hmm.
support. Yeah, so I mean, one of the organizations that I've seen and heard is within the city, the National Alliance on Mental Health Illness has a New York City chapter that offers like support groups
Then
for people with
can you
mental
say it again? The National Alliance of
National Alliance on Mental Illness.
on
Yeah.
Mental Illness. Great.
Mm-hmm. Has a New York City chapter that offers support groups within the city for mental illness.
Okay, that's helpful.
Mm-hmm.
Um,
Yeah. So, there's some others. One is called Fountain House that's dedicated to recovery of people with mental illness. So that's within New
House.
York.
Okay, great.
Mm-hmm. Mm-hmm.
Awesome. I've been following Eve Ensler. Do you know her? She's an artist, performance artist, and activist, and she has a lot of right now. She's doing a lot of advocacy for nurses. So
Oh,
I really recommend everyone check out her page.
yeah, that's great.
And she just changed her name to V, but her Instagram handle is still Eve Ensler.
Okay. Oh,
Author and a performance um, artist.
oh,
Uh,
good. Yeah, yeah. I've seen that as well. That there are different, like
yeah,
art organizations to reach out to for support.
yeah. I also follow Christian Northrup. She's an OBGYN who works now. She does a lot on online to support people and provide information. I follow her stories right now, which are really great. So I recommend her also. Um, I know we've been talking for about half an hour. I want to open up to the people who are following us. If anybody has any questions or comments, I see Sarah Sloan writes, "It's so interesting. I've been hearing from so many colleagues working in healthcare that they feel closer to coworkers now more than ever, leaning on each other for emotional support."
Yeah.
Definitely. I feel that also I work in a school and I do feel like although I'm not seeing my colleagues, people are actually calling me and having conversations and that are very vulnerable, and sharing of emotions. And I love that. And that's something I hope that as we reimagine our future going forward, whatever that's going to be, that we continue to have those conversations.
Right, right. Yeah, no, I think it's really important. I've seen that as well, and even reaching out to people that you don't know at the hospital um, that we're working with that we're not so familiar with, but it's been
Right.
just leaning on each other is really important and has
Yeah,
been helpful.
totally. I mean, I see that. I see people embracing strangers,
Mm-hmm.
more as brothers and sisters, and that just like feels like this energy of people coming together in a crisis.
Right, right. Yeah,
Totally.
it's helpful. Yeah.
Yeah. See who else is here. Clements, Meg Miller Photography. Maybe you know some of these people. Let's see.
I have seen a few that I know.
Oh, Sarah asked, Sarah Sloan, what do people out and about need to be wearing?
Right. So I would say, yeah, if you have, like you were speaking about, like a homemade mask, I mean, I think that is probably the best thing to be wearing. Um, and of course, if you're a healthcare worker, I've seen that the hospitals are making sure that you have your own surgical mask to wear at home and giving some extra
Right.
surgical masks. But I think, yeah, the homemade ones are wonderful. In this way, we can conserve,
Yeah.
supplies for the people that need it.
I mean, I've heard people say save the N95s for the healthcare workers,
Right. Right.
but to you can make a mask that it that you can make a flap inside and then put the filter inside.
Right.
Um, some people are using those. There's a lot of do-it-yourself versions that you can look them up on YouTube and just make that. I've been using that kind of thing. I made one mask with the little mini sewing machine I got.
Yes, I saw that. That was very sweet.
Yeah. Let's see. Jay Des is saying, just feel like it needs to be said that I may not be in a hot spot like New York City, but you all are constantly in my thoughts and prayers. Your sacrifice is truly appreciated. Thank you so much. So know that you're loved. Stay strong. You're making a difference. I really want to dedicate this to all of my friends who are currently, working in the emergency room. I had a couple of friends I reached out to today, and they said, "I'm sorry, I can't make the call. I have to work today, and I'm thinking about them all the time." I know this is a really hard time for a lot of people, and so we can collectively send our love and affection to you. I'm trying to learn a loving kindness meditation to share with my community at the school. One of the things we say is, may you be happy, may you be at peace, um, may you be free of all danger, may you have um, ease. So I say that, and I say that to myself,
That is really
and
nice.
then to others. So yeah, there's also we have a comment. Let's talk about other health essential workers in the hospital setting. So we have like the not only nurses but the doctors. We have respiratory therapists, the maintenance people that do all the cleaning and keep everything like the people that do everything to keep everyone afloat.
Right.
Oftentimes get overlooked for sure.
For sure.
You know,
Yeah, and the individuals working in materials management,
and
where the
material,
supplies actually come in, I think that's probably a really stressful job.
yeah, and food service.
Right.
Definitely food service in the linen department, um, uh,
Yes, they're all
patient
really
care
essential.
assistants, nursing assistants. There's different names for nursing assistants, like the medical assistants, patient care technicians, or patient care assistants. A lot of the people that are in these roles are doing a lot of the heavy lifting of patients, changing them, helping them with, you know, their urinal and all these different things that gives them even higher exposure.
Right.
So we definitely have to recognize these workers for sure.
Right. For
Um,
sure. Yeah.
What else? So, I mean, thank you, Erin. I mean, I guess, did you have any other things you'd like to share with us?
No, I think just that that's the 7 o'clock global
Oh, yeah,
performance of people playing, and rooting for us is amazing. So I think
right.
keeping up that.
Right, at 7 p.m. we have, uh, this live performance that people come out and they bang on pots, and
Yeah,
um,
it's really
it's a
nice.
way of saying thank you.
Hmm.
Yeah.
Yeah, we've all loved it. It's been great. I think keeping that up is important.
Yeah. So we want to encourage all the viewers right now to participate in that tonight, um, because the power of energy and intention is so strong. So just putting out that positive energy, just believe that it does make a difference, and it does. But yeah, thank you,
Of
Erin,
course.
for your
Thank you
service,
for having
your
me.
brave service, for joining us today, for taking the time to have this conversation. And I hope that that I'll meet you in person. And
I hope so too.
yeah,
After
yeah,
after
thank
the
you
safe
so
amount of
much,
time. Thank you so much.
and thanks everyone for joining.
Yes.
Okay,
Thank you.
take care.
Bye bye.
Bye.